Did anybody come to the lecture last year?
Not last year, the last one.
Last time.
Yeah, last year. So it's different than, yeah, you came last year. It's different than last year, so you'll get some new information. As we learn, we update it. And then everybody came. Everybody came to last lecture, part 1. Awesome.
Okay.
Thank you so much for coming. I pay you to come. We ready?
Yes.
Okay, good. Okay, thanks everybody for coming. Part 2, let's recap part 1 of cancer, our cancer talk. And really, cancer, honestly, is just chronic disease. So we can lump in all the chronic diseases. Will you turn the music off?
Oh, yes.
Thank you.
That's helpful.
It's beautiful, but I'll be distracted. Thank you. Is chronic disease. And cancer is the ultimate manifestation of chronic disease. So when we talk about cancer, it's because we all know it. We had a pet that's had it. We have a loved one that's had it. It's just a hot topic in this country in particular. And so and like I said last month, it became a passion of mine when my nephew was diagnosed with cancer. So last time we talked about the prevention of what can we do to try and prevent it, and this time we're going to talk about some modalities that we have at Florida Wild that we can help treat. And so we have taken those modalities from the human field. So everything that we're talking about, you may know somebody, a loved one, and you may decide that they should seek complementary care as well with their cancer treatment. And so some of these things that we're going to talk about, these modalities that we're going to talk about, may be beneficial to your loved ones. Are you doing the turn? Okay.
Yes.
Your heart. Okay.
I'm just trying to see your face on here too.
Okay, gotcha. So we talked about last month that prevention is way easier than the treatment, and it's a lot cheaper as well, of course. Once we start moving into the treatment of a chronic disease, it's very expensive. And it's very emotionally expensive. It's taxing on us as caregivers, and that affects our health. So we really want to gear our pet's life to the prevention of. But even though you do a perfect job, sometimes these guys are going to get cancer. And in Chinese medicine, I love this saying that every life is a candle that burns at both ends. And one end is genetics, and the other end is how you live your life. And of course, we can do lots with that end, but with the genetics, sometimes all the time, we can't really do much about that. So what do we want to do? How do we want to prevent cancer? We talked last time about that, is we want human, organic grade food. We want the highest possible quality. When we can't do organic, we just want high quality. We want filtered water, preferably. We want reverse osmosis. We want minimal exposure to toxins via the air and the ground. And I did believe I talked about my dogs. I won't even allow them to walk on well-manicured lawns. If we go for a walk, they have to stay on the road because those toxins that are in the groundwater or in the yards that they spray to keep the yards so beautiful have already been linked to lymphoma, and lymphoma is skyrocketed in our pets, and that's a middle-aged cancer that we see. We see that in our young pets. So, any toxins, food, particular pesticides that we use in our house on our pets, we want to be educated on how to use minimally and what to use, what's really important. And for me, heartworm prevention is still very important because we live in Florida. But flea prevention is, in my opinion, is on an as-needed basis. So we can talk about natural ways to do that. Everything that we do at Florida Wild is minimizing toxin exposure. And we do that by minimizing our vaccines. We're implementing our titers, which we talked about last time. We're minimizing our drug therapy that we use. There are times when we need to use drugs and we reach for them, but there are times when we don't. And most of the time when we reach for the drug, we've talked about it as a family, we've tried some things, and now it's time to reach for a drug. If it's an acute situation, that we need to reach for drugs, typically in acute situations, and that's fine. It's the chronic diseases that come in, the chronic allergies that we're continuing to suppress the immune system. That's when we see the manifestations of very sick patients, like our cancer patients. So we want to delay our spaying and neutering. So when I graduated from vet school, I was spaying between 4 and 6 months. And now we're learning that letting them have that heat cycle or develop the testosterone is extremely healthy and beneficial to them. Doesn't mean that you don't spay and neuter. It just means that you do it with the knowledge of what you're doing. So for females, for males, we want to push it to when the growth plates close, usually around 11 months. And that typically will allow enough of the hormone into their body to help. Of course, we are removing it when we spay and we neuter them. But at least it does help them. It's more advantageous. And then there's actually a study that's proven that if you wait until the growth plates close to spay and neuter them or remove their hormones, they have statistically less likelihood of developing osteoarthritis. That's something that we really see in our pets. So anything we can do to try to prevent that is critical. We talked about performing the metabolic analysis. That's what we want to do to find out what they're nutritionally lacking in their food and to balance them. And we want to maintain a healthy gut because the gut is a source of inflammation. Just as an aside, we kind of talked about the microbiome last time a little bit, and we'll talk about it again. The microbiome is so critical, and we talk about the microbiome linked to the gut and the brain, microbiome linking. And then when I left the lecture, my associates were like, microbiome in your brain? And I was like, yeah, like maybe it's just the effects of your gut affect your brain. And so then I went to research it and found out that you actually do have a microbiome in your brain. You have bacteria in your brain and they communicate with your GI tract. So that's why it's a profound gut and brain connection is profound and it's real. And so we need to make sure that our gut is very, very healthy. We want to keep our teeth clean. So a lot of times we forget about the teeth. The teeth are a source of chronic inflammation and pain in pets. Sometimes we don't realize it until they have a dental. And then, after they recover from the dental a week later, they're bouncing around like puppies again. And they haven't felt this good in forever. And they've hidden a bad tooth. And we don't brush their teeth every day. Typically, they're not flossing. We're asking you to feed a meat diet. So the chicken is now getting all caught up in their teeth or the meat, and they're not flossing. And so this is a great source of decay. And so those routine dentals are really important in keeping the inflammation down in their body. And so what we want to try to do, along with keeping them healthy, is to work on early detection. So I'm always learning and trying as best we can. And there have been a lot of cases when we've decided we want to take a patient to ultrasound, abdominal ultrasound, and maybe it was a little bit early for the client, but we said, let's just do it. And we've found splenic masses that need to be removed. And so there's a lot of indication for letting us do those tests that we want to do if you can, because we can detect some disease early and save some lives. So metabolic analysis, again, I think the biggest thing on metabolic analysis is allowing us to look for toxins and inflammation, and we can see that. And if we're dealing with a pet that's super inflamed and toxic, it becomes a little bit more critical for us to treat that pet aggressively to bring down the inflammation. Because cancer is, everybody's just realizing and understanding with this study, functional medicine doctors have understood this a lot longer than us. I was like, they've understood a lot longer than us that inflammation is really a route to disease processes. So we're using Digitherm. When I wrote this lecture last year, my hopes are that we would be using digital thermography more as a pre-cancer scan, and we're not good at it enough quite yet to do that, but we're getting there. So I'll talk a little bit about digital thermography. And then when patients hit 7, we really want to see them every 6 months. And I know it's a burden, but if I just tell clients, 6 months is 3.5 years for you as a doctor. A lot can happen. And there's a lot of times when we diagnose a heart murmur, and we saw your patient just 6 months ago. but your pet just 6 months ago, and now they develop a heart murmur. And the earlier we get on it, the more we can help them and the longer that they can live a better life. So back to digital thermography is still a work in progress. I just want to talk to you about it quickly because we might talk to you about doing it with your pet. Right now we're using it mostly for pain and inflammation. So if a pet comes in that has some inflammation or pain, we can't identify where it is, or we think the source is maybe the back right leg, but there could be more inflammation elsewhere that we want to treat. Digital thermography is wonderful because it is detecting minute gradient changes in temperature. And what's inflammation is heat, and that's going to show up. So digital thermography is being used for breast scans, and they're recommending for women to start at the age of 20. Every year they get a digital thermography breast scan so that they can see the normal tissue of their breasts, and then they're able to detect inflammation prior to it potentially becoming cancer. And so they're treating it that way, functional medicine doctors. That's really exciting, and also just as an aside, you're not squishing and irradiating your breast every year. So not that I would advocate for you not to get a mammogram. It's just a nice something that you can use in addition to your typical treatment. Cool. We got a lot to cover. So diagnosis of cancer, it's really scary. We diagnose it all the time here, unfortunately, and it's always hard to tell the client that we're dealing with a big C because it's really scary for clients because we know it so intimately. So that's the first thing, is kind of getting over the trauma of knowing that you have to deal with it, and then we start talking to you about what it means. So this is something that I created, and it's the tools that we have at FloridaWild to help treat cancer. Cancers, is extremely difficult to treat. I wish I had the statistics for you, but I didn't have time to gather them, and I need to get them for next year. But we basically made little to no difference in our cancer treatment prognosis with our chemotherapy since when we first started using chemotherapy. There's a couple of cancers in which chemotherapy is advantageous and highly recommended. My nephew, testicular cancer, is curable with chemotherapy. Lymphomas, leukemias, those are actually respond to chemotherapy, but there's many cancers that you go through all this chemotherapy, you get your body knocked down, your immune system is literally just completely stripped away from you. And by the way, typically oncologists, because I went through this personally, recommend that you don't take any supplements or you don't take any antioxidants, and you can eat whatever you want while you're in chemotherapy. So that's the recommendations out there from Shands, which I respect and think is an amazing cancer hospital. But those were the recommendations to my nephew, that he wasn't allowed to take an antioxidant that may interfere with the chemotherapy. And I don't know if you know anybody that's been through chemotherapy, but if they think that vitamin C is going to interfere with chemotherapy, that's insane. It will wipe you out completely. It targets multiple things, including your bone marrow and your bladder. It also targets your brain. And so you have a lot of side effects from going through chemotherapy. Not that I'm advocating don't do it. You sometimes have to, we have to do it, but we need to go in knowing all the pluses and minuses about going through it. And we need to go in smart, and we need to go in supporting our body, even if we have to go through chemotherapy. If we're supporting our body while we go through it, then our recovery time is going to be much better. And the chance of another cancer rebounding from our chemotherapy is less likely. So that goes along with our pets as well. So multimodal, this is a very difficult disease. Cancer's smart. Cancer goes into the body. It creates itself a little home. It's walled off from the rest. It hides, and then it stimulates blood vessels to come and feed it. And so thinking that there's one way to treat cancer like chemotherapy is, in my very humble opinion, silly. Cancer is very smart. It's designed ways to evade our immune system, so it's gonna be very difficult to treat. So we don't have one thing that we use at FloridaWild, which is why we talk about the expense of it. Do me a favor and go downstairs and cut the AC down again, because I'll be on the slide for just a couple minutes. I'm already sweating, thanks. So we got to do a lot of different things, and that's where it becomes really taxing on us emotionally when we're doing it. So we have to make sure that we're taking care of ourselves along with taking care of our pets because it's exhausting. We start with nutrition, of course. It's the foundation of everything that we do at Florida Wild. We can treat a lot of diseases just with nutrition, but we can't ask a patient that has cancer to detox processed foods. It just makes our life that much harder, and it's so much more energy depleting on the patient. So the more delicious, home-cooked, nutritious foods that we can feed these guys, the better that they're going to do. And we may not increase longevity, although we typically do at Florida Wild, but we're going to increase quality. And so quality is very important. So we're going to talk about home-cooked diets, and we may work on a different diet depending on, we're going to go into more depth, but we'll work on the diet depending on the patient. There's not one size fits all for any single pet. Then we also have immune-targeted treatment. We're going to talk about these specifically: intravenous vitamin C therapy, Wave, which is new to Florida Wild. We're seeing some pretty cool stuff with Wave. Ozone Therapy. Acupuncture is not new to Florida Wild. We still use that with amazing results. Microbiome transfers. So we're taking poop out of a really healthy dog and we're putting it into an unhealthy gut. And we'll talk about that a little bit more in a bit. Then we use supplements. And the supplements are, again, never one size fits all. They're customized to your pet. What does your pet need? We talk about Western chemotherapy because there are absolute times with lymphoma patients, I incorporate chemotherapy into my treatment protocol. They have better quality of life, they have longevity, and it just works really, really well. But there is absolutely not one single protocol. If you develop a cancer, so I'm pointing to you. You three are so completely and totally different. When you go to the hospital, there's one treatment protocol for you, period. You don't get anything specialized to you. You only get specialized cancer treatment to that cancer. And so that's, for me, a huge fundamental flaw in the treatment of cancer is that it is absolutely 100% not, it is not the disease. You have to treat the pet. Why did the pet manifest the disease? You have to try to get to those causes. We use homeopathy. Lots of success stories. I think we talked about last time using lymphamycin, which is the homeopathic clears the lymph nodes. Knock on wood, I have a patient coming in for a growth of minor little mole that we diagnosed lymphoma in the chest at 6 months plus 7 months ago, and it was taken up almost the whole chest. We did 1 dose of chemotherapy, and the only thing these guys could afford is the homeopathy, and we've used the homeopathy since then. This dog's been in remission for 7 months. So it's very powerful, and so we use it for a lot of different reasons. We're going to detox their body because, again, we got to build up the toxins. Then once we start killing the cancer cells, which we're going to talk about in a little bit, that's just more toxins in the body that we've got to detox. So we got to keep on detoxing and flushing these bodies to keep them healthy. We talk about antioxidant therapy, critical with cancer patients, critical with mental patients, cognitive behavior, Alzheimer's. Antioxidants are critical for the brain health. Vitamin D, we're actually going to spend a little bit more time on because vitamin D is so important to us. And CBD oil is a very powerful antioxidant that we'll use, not in all patients, and there's not one thing for all patients, but in some of our patients we recommend CBD oil. Glandular support is what we use for supporting certain organs. So there may be a patient that is not functioning optimally with the thyroid gland, and we don't need to use drug therapy, but if we support them with glandular tissue, it can be very advantageous. So they're just catching on to this in the human medicine field, and they're just starting to use glandular therapy with thyroid disease, and it's incredible. And nobody really knows why it works because it's ground up beef or pig organ that we're feeding back to the animal. Nobody really understands why it works. We just see that it works. And so some theories are that it's actually giving the micronutrients needed for that organ to survive. There's another theory floated out there that the glandular tissue is actually like a decoy for the body. So our bodies a lot of times get confused because our immune system isn't smart. Our immune system just does what it's supposed to do, but it doesn't really know what it's doing. So sometimes it can get off on the wrong path. And so maybe it's attacking the thyroid gland. So if we supplement thyroid glandular, the immune system decides to attack it, the supplement, and leaves the body alone. I don't know. I don't know if that's real. I don't know what it does, but I know that it works. I've been using kidney glandular for 15 years before I started doing more glandular therapy, and my cats were healthier with kidney disease, were healthier and lived longer than any other patient that I've seen with nutritional therapy and glandular therapy. So it definitely works. We use immune boost supplements, and so it's boost is, yeah, maybe boost, but it's more like wake up. You're sleeping, you allow this to happen, and now we've got to correct ourselves. And so we'll use Whey Chi Booster, standard process, and probiotics to do that. And then did I put, oh, I've got supplements, Highdose Pinker, we'll talk about that. And then on there, the only thing I didn't put on that, which we'll talk a little bit about, is our vaccine that we use. So we'll take a piece of the cancer and we'll actually create a vaccine and give it back to the animal. So we're still kind of in the research phase. We've seen some really good success with it. We've seen some not so great successes with that, but they're really working on that at MD Anderson. And so at MD Anderson for humans, they're actually taking some grade 4 cancer patients and they're putting them into remission. They're harnessing the body. They're harnessing the tissue of the body. And what is that? It's an individualized cancer treatment, which is exactly what we need. And so I think, did I talk about Between Heaven and Earth last month? I'm reading this book, Between Heaven and Earth. It's a beautiful book on acupuncture. Yeah, beautiful. It's lay. It's written in lay terms so you can understand it. It's wonderful. But it talks about how we deviated so drastically from treating the whole body. And so in Chinese medicine, it's gorgeous because you're treating not only the whole body as a separate ecosystem, but you also treat the environment as an ecosystem and how that affects the patient. So it takes the whole world, the whole community, the whole family, the whole individual into consideration. And so we literally, in Western medicine, have started treating the body like a machine. And so we've broken it down into tiny little pieces and parts. So now we have 15 doctors who know, somebody knows about the eyes, somebody knows about the ears, somebody knows about the heart, somebody knows about the GI tract. And so where it's great sometimes because we need acute medicine and we need somebody to go in and do surgery, and surgery is really great in the United States. When it fails is when we're in chronic disease. And when the chronic diseases occur, we've got a breakdown in the body, and so we can't rely on our one oncologist doctor or our one eye doctor to figure out how we are working as a whole, what our imbalances are, and what our imbalances in the environment are. Okay, that's a lot. Does anyone have any questions or any comments before I'm going on? I feel like it's so much information.
I don't know if it was in that book, but they were comparing traditional medicine, the doctors, as weeders.
Beautiful. Exactly in that book. Yep.
Eastern medicine grows the plant, so
right.
they're proactive.
Culture. Yeah. So that's exactly right. So I love that analogy. So she was just saying that in Western medicine, it's more about weeding out and getting the bad disease and pulling that out. And in Eastern medicine, it's cultivating the plant, it's nurturing it, it's feeding it from the ground up. So that's a beautiful analogy. Like there's so many beautiful things in that book. It's a wonderful read. Okay, so the goal is for us to use the arms. We have to use all the arms to figure out what we're going to do, and there's no treatment that works alone. I suspect, although I've never been to MD Anderson, that they do not just do immunotherapy on the cancers. They also consult about nutrition, and they're more of a holistic cancer treatment center. So I'm not sure, but not one thing is going to work by itself. And we talked a lot about nutrition. Props to Charlie, who's here again from Rick's Dog Deli. I appreciate him so deeply because of his fight and work for our pets and providing amazing nutrition for them. And I'm just super appreciative of him. And so we want to nurture the spleen in Chinese medicine, the GI tract. We want to provide an environment for the microbes to grow and do well. And if we do that, then that's just going to help the immune system. A lot of times with cancer, we're going to talk about a ketogenic diet. And we float that out there. Again, it's not for every patient, but cancer does feed on sugar, and cancer and carbohydrates are sugar. And so by increasing the meat and the fat content in our diet, which we do have some diets that are ketogenic, that can sometimes help. There have been reports on the internet of the only thing they did was ketogenic diet and it cured the cancer, but I feel like we need to use all the modalities when we're dealing with cancer. I typically don't recommend grains when I've got a cancer patient, although that can vary. It depends. And of course, it's still got the unknown grain-free diet heart link out there somewhere floating. So again, I'll just hammer in, rotate when you can, so that we're making sure they get everything that they need. And then when we use carbohydrates, we want to use complex carbohydrates. Go ahead. Touch on metabolic analysis really quickly. This is mostly for people who are joining in on us, who may have not heard last month, but it is an in-depth analysis of blood values. Blood values that we typically look at between a normal range. And the normal range is very wide in Western medicine because we're taking averages of many animals. Where we want them to be is in a functionally optimal level. And so it takes that wide range and it narrows it down. And so we plug the values of your pet into that, and then we look and see where are they not functioning optimally. And if they're not functioning optimally, say their white blood cell count, that could mean that they're dealing with toxic conditions. So then it goes, whether it's elevated or increased, or elevated or decreased, it goes through reasons why it may be. So perhaps vitamin D is low. Perhaps we need to add some essential fatty acids. Perhaps the amino acids are too low. And so it better enables us to tailor a prescription diet, not prescription from the big companies, our prescription diet, home cooked food of what your pet will benefit from. So a couple of notes on here just that are really important. Just as a reminder of the thyroid gland and its importance, it is the engine that runs the body. It's the engine that runs the immune system, that helps with the immune system. And so when we're doing this blood work and we see, even if it's a mildly low, which normal is like 1.1 to 2.5 in dogs, if we're at 1.1, we're not functioning optimally. So we want our thyroid levels to be at 1.6 or greater, a little bit greater than that. So we know that our immune system is functioning optimally in that regard. So thyroid levels, very important with us. Glandular therapy, we talked about. Immune support glandular therapy, we use thymus. Thymus is a gland that sits in your chest that regresses after you're born slowly. By the time you're an adult, it doesn't do too much. It's very important for your immune system. And so when we give them thymus, glandular support, it can help stimulate the immune system. Whole vitamins, we use herbals. We use herbals to induce cancer cell apoptosis. So apoptosis is cell death. So we actually have herbals that will kill cancer. Very powerful herbals. Turkey tail mushrooms. Turkey tail is incredibly important. There's lots of studies coming out about turkey tail, which is a mushroom. And what it does is it blocks angiogenesis, and that's when new blood cells are made. So the cancer is very hungry. It needs lots of red blood cells to come to it. And so the turkey tail stops that creation of red blood cells. So it's very important. It's also anti-infectious, liver support. It's great for detoxing the liver. And mushrooms in general are wonderful for bone marrow support. So we've got a patient on chemotherapy. We're going to talk about some type of mushroom therapy for sure. So more supplements that we use, we talked about hemp oil, and you know, last year it was turmeric. So I feel like every year, because it's really becoming okay to look outside the box for treatment, turmeric was the hot item to use. So everybody wanted to put their animal on turmeric. This year it's CBD oil. Everybody wants to put their animal on CBD oil. And both of them are amazing, and both of them do wonderful things. CBD oil, so I have it written down. You guys can get a copy of this too. So it enhances the internal cannabinoid system, which is an extremely powerful antioxidant. Does everybody understand what an antioxidant is? I know we say that word all the time, but do you know what it is? So in disease processes, there can be cells that are free radicals, and they break off, and they kind of, I always think about them just like bouncing around, causing damage. And so antioxidants just kind of go through the body and scavenge. That's a gross interpretation of what it is, but they go through and scavenge the free radicals. so that those cells, the damaged free radicals, can't continue to cause damage in the body. So CBD oil is lovely, lovely, lovely for that, but it doesn't work in all of our patients. Some of our patients get sick from using it. Artemisinin, I love to say that word. So this is pretty cool. This has been used for the treatment of malaria. Very wonderful treatment of malaria, and we're also using it in the treatment of, what is it, Dr. Schrager? Bartonella, Babesia? No, Babesia. So we're using it also for the treatment of Babesia, and this is because these are red blood cell parasites. So, do what?
Blood cancers.
Blood cancers. Yeah.
Yeah, it's malaria too.
Yeah. So that's where we actually stole it from. We stole it from the malaria treatment. But it binds to the iron and it depletes the iron so the cancer cells can't exist. And so iron lives in the red blood cells. So it works pretty nicely for some of our blood cancers. Wei Qi Booster is a Chinese herbal that we use to help boost the immune system or to quiet the immune system down. So it's an immunomodulator. It's from Jingtong, the company that I use almost exclusively for Chinese herbs, and it works wonderfully to balance the immune system. Stasis Breaker and Max, these actually are anti-cancer herbals. And so we'll use these herbals to fight cancer, and we have to then watch the bone marrow and make sure that we're not knocking the bone marrow out because they're very powerful. But the thing about those is that it's just a general anti-cancer treatment. So usually we pair a Stasis Breaker or a Maxis formula with a transporter. So we want to transport it to the location of where the cancer is. So say your pet has liver cancer, we're going to use Stasis Breaker, and then we're going to use another herb that targets the liver. Maybe it's liver happy, maybe it's Jayasan, but it's going to take the Stasis Breaker directly to the liver. So we also use probiotics for gut health. We use homeopathy, and we talk about vitamin D. So obviously, if you're in my care with a cancer patient, you guys are for sure, we don't use all the things. So we use the things that I think are most important for the pet at that time. If we use all the things, then you guys are going to be given this many supplements and this much food. So there's an art in trying to figure out what we think is best for your animal and being able to try different things and use different modalities. So let's spend just a minute on vitamin D, because vitamin D is so important. So for a long time, vitamin D is known for maintaining calcium homeostasis. You get vitamin D from your diet, but you also get it from sun exposure. So what happened, 15 years ago, when there was this craze on skin cancers, we started slathering ourselves up with sunblock. And so we weren't getting the rays that we are typically getting. And so we started to see a real depression in vitamin D. And also we're seeing a depression in vitamin D because our vegetables, we talked about last month, that our vegetables just aren't as healthy as they used to be. So we're seeing a direct link, and this is actually reported by the NIH and NCBI, which in my opinion, that's National Institute of Health. But those are the big wigs that do the big studies, the huge global or huge US studies, is that they're starting to understand vitamin D a little bit more in depth, because they're seeing that across the US, actually across the globe, that MS patients and patients that have immune dysfunction or suppressed immune systems or chronic diseases or immune systems attacking themselves are across the board low in vitamin D. So that triggered them to start researching, what is vitamin D doing for the body? Obviously it's doing something. And in fact, they found out that vitamin D actually plays a huge role in the immune system. And so what vitamin D does, which I wrote down, is it actually, there are receptors on B cells and T cells, and those are your immune cells. So there are vitamin D receptors on them. And there's also antigen presenting cells, there are vitamin D receptors on it. What an antigen presenting cell would be like, if Hannah was a cancer cell, I would say, come here, Hannah. I present you, Hannah, cancer cell, to the immune system. Immune system, see this cancer cell? Please destroy it. So you can, thank you so much.
That's why she used to be not any of y'all.
So you can see how important, yeah. You can see how important vitamin D is. So when we don't have vitamin D and we don't have these receptors that can present the antigens, then the cancer can hide out in the body because it's not, the cells aren't being presented to the immune system. So where this paper didn't cross over, which was very interesting, I read word for word this study, it didn't cross over into the realm of talking about cancer. It only talked about chronic disease. Clearly, we can see that vitamin D plays a huge role. Functional medicine doctors have known this for a very long time. Now, what we're trying to understand is what's really our normal level of vitamin D. Because on your blood work, your normal level is between 30 and 100. What functional medicine doctors are saying is, no, we need it up higher. We need it between 70 and 100. So vitamin D plays a role, very important role in our cancer patients. And I don't think there's a, correct me if I'm wrong, doctors, is there a cancer patient that you've tested vitamin D level on that's been normal? Nope. We have not seen a cancer patient that we have tested that has been normal. I just got back one a couple of days ago, and I'm wanting it 100, around 100 in animals, and this little kitty cat was at 32. So they're usually very, very low. And so it's extremely important to make sure our vitamin D levels are normal. And so what can you do as an owner in preventative medicine? You can get your animal vitamin D tested every single year. So they can make sure that our vitamin D levels are up. And it's one more box that you check to make sure that your pet is not going to be deficient in vitamin D. So it's not, again, it's not going to do 100% preventing cancer, but it's one more box checked that can make you feel more secure that you're doing everything you possibly can. So some treatment options that we have that we're going to go in depth. You can go ahead and click over to the next one. Quick. So we talked about fecal transplantation, which is really disgusting to think about. And we got into fecal transplant about a year ago, speaking with a doctor up north that's she's dedicated her life to doing this. And as I started to research it in the human medicine field, realized that they're using this to treat C. diff in the hospitals. So C. diff right now is very dangerous and fatal to a lot of our patients, human patients that are in the hospital, and they have a extremely low 30% success rate treating with antibiotics and medication. So we're losing a lot of patients to C. diff. They started doing fecal transfers. Either they're tubing the patients and putting the healthy poop inside their stomach, or they're taking poop capsules. They have greater than a 95% success rate treating C. diff in the hospitals. So when I read that article, I got super interested in it. And then funny enough, like, you know, when something happens and then like all of a sudden the world starts presenting more information to you, then a lot of information about the gut biome with the brain biome started just really coming to the forefront of a lot of research, a lot of anxiety, a lot of depression. We have terrible guts in America. We treat our guts so harshly. So of course we're going to see our brain microbiome suffer from it, and we're going to have anxiety and depression. We see that with our pets as well. So vitamin D. So fecal transplantation here at FloridaWild is a super simple procedure. So we screen our pet. Right now it happens to be my dog. He is little medication. Tiny little bit of medication he's had his entire life. He's titered only. He's an extremely healthy guy. We send off the poop to Texas. They analyze it for all the things that we want, including a dysbiosis index, meaning how broad a range are the microbes. And then we prepare a slurry out of it. That is not my job. Thank you. And we put it in a special freezer held at a certain degrees so that the microbes can remain viable. When you're talking about a probiotic, probiotics are lovely. I don't knock the probiotics. They're fantastic. But you're replacing 10 to 12 of the microbes in the gut. Your gut has thousands and thousands of microbes that work as a concert. They talk to each other. They work together. And so where your probiotics are great, you may have a situation that's dire and you may really need to replace the microbiome. So we can do that very easily with a rectal slurry. We give them and we hold it in for 15 minutes and we provide nutritional support so those microbes can make a home there. And so we've seen some really great benefits with that. I had a cat who had pulling out its fur, really disturbed little kitty cat, and this happened acutely later on in life. And we tried a lot of different things on it, and finally we're like, let's just do a fecal biome transfer, and it worked. And so he just came in for another tune-up because he had just started to lick a little bit more, and we gave him microbiome transfer, and he's doing great. So there are some patients that respond beautifully to it. Ozone therapy. So ozone therapy is amazing, and there is no reason why we shouldn't be using it for our people as a first line of defense all the time. Dr. Frank Schallenberger, if you have interest, we talked about it last time, go on his website, read what you can. He's got a couple of great lay books out there about ozone therapy. You can order ozone therapy to do for yourself at home, which my family does. But ozone therapy does just a cascade of things. I mean, just so many things that are great for the body. Each cell in our body has mitochondria, and the mitochondria are the energy producing part of the cell. They're the engine of the cell. And as we get older, our mitochondria is depleted. And so that the mitochondria that's depleted, we get tired and worn out, not physically, maybe physically, but our body does, and our body is not able to do what it needs to do. So helping the mitochondria has been Dr. Frank Schallenberger's life's work. So he can test for it. There's some local doctors, one in Tampa, that can do it. But the bioenergetics testing that Dr. Schallenberger developed. And then once you get the level of the mitochondria, then you can start trying to replace it. Those patients that have highly functioning mitochondria are the ones that just so happen not to get chronic disease and not to have cancer later on in life. And so he's published a lot of studies on that. It's pretty fascinating. Essentially, ozone therapy is oxygen, medical grade oxygen that goes through a machine, gets electrified, and the O2, which is oxygen, breaks up and then reconfigures into O3. O3 is ozone. It's very unstable. We only have about 15 minutes of therapy, so we need to use it very quickly. So what the ozone does, we can give it into the vein. So we'll pull out blood, we'll mix the blood in the ozone, and we'll give it back. Or we can infuse it rectally, or we put it in our sub-Q fluids, or we put it in the eye. So we have lots of things that we do with the ozone therapy. When we're doing it, we talked about it being really unstable. So the ozone doesn't want to stay O3. It breaks down in milliseconds to O2 and O1. So we talked about free radicals. O1 is a free radical, but this is the free radical that you like. This is the free radical that starts the immune system saying, what is happening? It wakes it up from a sleep. It targets certain areas, and it starts an enzymatic process that leads to essentially the immune system waking up from the sleep that it's been in and not seeing the cancer. But it does so many more things than that because now you're infusing oxygen into the body. So oxygen is super, super critical. Study after study after study showing that oxygen depleted people are more likely to have chronic disease. They're more likely to have cancers. So oxygen is very important. Vitamin D is very important. Your mitochondrial function is very important. So all these things that we're doing is to try to prevent it. So you guys can have a copy of this. I'm not going to read it out to you, but it does so many things that are great for your body. Dr. Schallenberger works on anti-aging, which is what, again, his life's work is to try to have us age instead of, oh, we're 70 now, we're on 10, 15 medications because I'm on 10 medications and I'm on 5 because of side effects of the 10 medications that I'm on. His life's work is to keep people off those medications as much as possible. Intravenous vitamin C therapy we use all the time here. So we use only a certain brand of ascorbic acid that can be used in the vein. And we use it at small doses, medium doses, and then very large doses. We work up to the really high doses. A lot of times my metabolic analysis will dictate the ozone or the intravenous vitamin C therapy that I use, because a lot of my metabolic analyses on cancer patients, vitamin C gets hit over and over and over and over and over. So vitamin C is another super important antioxidant that helps keep us healthy. We all know it. That's like the one that we know. Eat the oranges and suck on the vitamin C's when you're sick. So when we're providing this super powerful intravenous vitamin C therapy, it's supplementing the vitamin C that they're lacking, but it's also supporting the immune system. So let me go back to ozone for just 1 second. The other amazing thing that ozone and intravenous vitamin C therapy do is they fight, for us, infections. So we talked about last month some crazy cases that we've had with ozone therapy. Intravenous vitamin C, Dr. Schrager and Dr. Hathaway have treated 3 mastitis, 2. 3. I thought it comes in 3. Gangrenous mastitis. So the bitches that are nursing the babies, literally overnight, their teat chain just turns black and starts to rot off. And most of these cases will pass from sepsis, and it's just a terrible, terrible way to go. These ladies have treated 3 now successfully, 100% right now, batting 1,000. And they're using combination of ozone therapy, intravenous vitamin C, and they're going right to surgery to remove the masses. And so super proud of them. Shout out to them, because I really want them to write that up in their free time, because it's really, really impressive what they've done. Dr. Barbara, she was really cute, because Dr. Barbara's our new doctor, and she came in and she goes, oh, we used to see these all the time. None of them survived at the University of Georgia. So that's because we're using all the modalities. And we'll talk about acupuncture later, but acupuncture also plays a huge role in saving these guys as well. Oh, back to intravenous vitamin C really quickly. There are studies published that the intravenous vitamin C actually kill lymphoma cells. So many studies out there from our Western friends, and that this high ascorbic acid in the body will target the lymphoma cells and destroy them. So we use it 100% for our lymphoma patients. We try to keep them in remission with intravenous vitamin C, in addition to chemotherapy if we need to. Thank you. And the animals just feel better when they get vitamin C. They just feel so much better. Acupuncture, it's about balance. It's always about balance for me. Balance is so beautiful with acupuncture. You can treat the excess conditions. You can treat the deficient conditions. You can make them feel better from pain. What other modality is there that I have a patient that came in the other day as a second opinion with hyperthyroidism, heart disease, cancer of lymphoma, skin disease, weight loss. There's no other modality that I have that I can do one treatment for, and it can cover every single thing. It is the single most powerful thing I have, because when we talk about energy in Chinese medicine, and we talk about pain or cancer, that's stagnation. And stagnation creates pain or causes the cancer, and acupuncture can help move that. And so it's a wonderful modality that we have. Very quick story. My dog loves to eat naughty things. He ate my daughter's underwear, and this is his second time. He's 10 years old now. Second time on Saturday morning, he looked at me, puked, projectile vomiting, and in 2 hours I was cutting out a pair of underwear from his stomach. When he went under anesthesia, he had massive regurg out of his nose, out of his mouth, just really profound buckets of regurgitation. So my biggest fear came true, in that he was going to have burned his esophagus. So he had severe esophagitis post-operatively. He couldn't eat, he couldn't swallow very well. He was really suffering. And so I did acupuncture on him in the evening, and I was just doing needles because I thought, I don't really want to do electroacupuncture on him yet. I was kind of being a little wimp, because sometimes I'm a wimp with my own animals, and shame on me. And Dr. Hathaway said, hook him up to electrodes, get it stimulated. That's what we do with our mastitis cases afterwards. And so I laid him down at home at night, and this is day 5 of no food, regurgitating water, starting to get weaker because he's not taking anything in. So I laid him down that night sideways, hooked him up, zapped the heck out of him. About 10 minutes into his session, I started hearing gut sounds. gurgling all over. First time I had heard gut sounds with him. His gut had just been completely non-moving. So he had postoperative ileus. So put the electrocutor, started gurgly. He never regurgitated again after that acupuncture session. So I did 2 more. It was completely great now. He's at home eating on his own. But that was, to me, and even after I've been doing it for 15 years, is just profoundly an aha moment for me, that how it can affect some of our patients. So it's just great for every single thing that, if I don't offer acupuncture, then just pop me upside the head, because I'm just not thinking about it for the minute, because it really can be used in every single case and every single patient. I'm going to touch really quickly on a few more slides on high-dose pancreatic enzyme therapy. I followed a wonderful doctor who has passed away. He's up in New York, and he, I can't think of his name, Nicholas Gonzalez. So Nicholas Gonzalez's life work was trying to treat pancreatic cancer. And he was so successful at treating pancreatic cancer, and he has a wonderful backstory in his life, that the NCIH decided that they were going to take his model of what he was using and try to do it on a large scale. Because we all know that pancreatic cancer is about 100% mortality. And so his patients were actually about 40 to 50% mortality. So the NCIH caught what he was doing and said, what are you doing? And so besides all the other things that he's doing, because again, we don't use one modality in cancer, he was doing food therapy, immune modulating therapy. He was also using high doses of pancreatic enzymes. He was using the high doses not when you eat. It wasn't to help you digest the proteins in your body. It was to help digest the cancers. And so when you're not eating on an off time, say at 10 o'clock in the morning, you were to take 20 or 30 pancreatic enzyme tablets. And then he had another process to help detox the body from the cancer waste. When the NCIH got word of this, they decided to do this on a grand scale. The problem with it, and why it failed completely, and they called Dr. Nicholas Gonzalez a quack, is because how do you take a therapy that you individually treat each person with and do it on a grand scale? So when it failed, he then wrote a book, published, what went wrong, and that was his rebuttal to the NCIH telling him, you don't know what you're doing. Meanwhile, he continued to cure people that were stage 4 incurable patients. So he's pretty amazing. Metabolic cancer vaccine, this is just one of the companies that we use. This again is just touching on the immunomodulating. This is where cancer treatment is going in the future in America. And it's very exciting for me, because at least it's not one size fits all. At least they're taking the cancer that your body's growing, and they're also, and they're creating a vaccine and they're giving it back to you. So the point of that is, again, wake up, immune system, look and see what you've got to fight, because you can fight it. The immune system can do what it needs to do. We just need to give it the opportunity to do that. So unfortunately, we can't do it in cats, which I learned with these lovely people. We can only do it in dogs right now. And like I said, we're still, we still have a somewhat good success rate. It's still, the data is still out there to be done. Tweaks need to be made, and it just needs to keep improving. Sauna wave therapy, I'm really sorry. There was so much I wanted to write about sauna wave therapy, so this is for you guys to read later. Really quickly, this is something we've been using for a year. It is extremely promising. Dr. Nunez at Integrated Veterinary Hospital is an inventor as well as a veterinarian, and he came up with this smaller unit so that we can use on our cats and dogs and patients. He actually stole this from the human field. So the human functional medicine doctors were using this, and it's radio frequency waves. And so what we do is like a heating pad that we put on this, and typically we're having success with solid tumors on the outside of the body. And I'll tell you about some success stories that we've had. But so the pet has a tumor right here. We're going to put the sauna wave on it. We're going to hold it for 30 minutes to an hour. We're going to put the sauna wave over the thymus. Again, there's that word in the chest, because we want the immune system to be stimulated. And it's shooting radio frequencies into it. And this does a couple of things. The radio frequencies make the cells start moving very quickly, and it generates a lot of heat. Cancer doesn't like heat. The other thing that it does is it knocks the guard that the cancer cells have right off. So now what it's doing is it's exposing the cancer cells to the immune system. So the immune system can then say, oh, okay, well, I see you now, and now I can circulate and try to kill you. When we have a tumor somewhere, we can rest assured there's minimally, and this is, I guess rest assured is not really a good way to say this. We can be sure that 100,000 daughter cancer cells are in our body. So we know that we take off a tumor here, and if it's a low-grade cancer, we may be just fine. But oftentimes it's not, and we've done a couple things. Number one is we put a scalpel blade to a tumor, and what does that do? It increases blood flow to the tumor. So that's a little scary. So we're cutting off the tumor, and now those daughter cells, this really smart cancer, the daughter cells are inactive in the body until that main tumor is removed. The minute the main tumor is moved, boom, the daughter cells get cut on. That's why you see years later mets in the lungs, mets in the bone marrow, mets somewhere else, because those daughter cells have been turned on. When you're using the sauna wave prior to, you're now telling the immune system, this is the enemy I present to you, and now you can, the immune system is going to circulate in the body and try to get those daughter cells. And so that's why it's so important for us to use it before we do our tumor surgery in some of our patients. I had a dog that had a very tight fibrosarcoma diagnosed on fine needle aspirate down here on the ankle, and the owner said, I don't know. And I said, well, let's just sauna wave it. This is new to us. Let's just try it. So we sauna waved it 3 times a week for 3 weeks. And what happened is that the tumor started to separate from the body, and it pedunculated. So it became like a stalk. So now the surgery that was going to be very invasive, and I was going to have to remove muscle and very painful recovery in an old dog, became a very simple surgery. So when we sent that tumor off for histopath, it came back as a benign tumor. Now, I don't know, guys. I still feel like there's something happened, and I'm not saying that. But what I will say is that it made my surgery so much easier. The patient recovered quicker, and now I know that the body is looking for those cells. And so that makes me feel comfortable about it. And we're still months out from surgery, and there's no sign of recurrence. You can skip through both. Okay, I think this is my last slide. When do I recommend chemotherapy? We already talked about it, very few cases. When I recommend it, I do, a client came to me with her very, very old cat with lymphoma, and we talked about the pros and cons of even doing a little bit of chemotherapy. And we elected not to, but most of the young patients, I'm going to do a little bit of combination chemotherapy with all the other things. And they do really, really well with that. But again, we're not just using the chemotherapy, and we're not just telling you, please feed the crappiest food that you possibly can find, because we don't really care. We just want your animals to eat. We're supporting your pets in all the ways while we use the chemotherapy. So much information.
Have you found any of these therapies to increase the problem?
That's a great question. His question is, have you found any of these things, the therapies that we're using, to increase the problem? That's a solid no. Solid. Nope. I have only made patients feel better. Now, perhaps I did not extend their life, and that is definitely a possibility with some of the aggressive tumors, but I most certainly made them feel better. And there are lots of cases where we've extended the life, lots of cases. Dr. Schrager commented the other day. She said, she's worked many years in other vet clinics, and she said, you by far have the oldest population of pets at FloridaWild.
Do you feel that all the therapies you've used on animals will work as well on humans?
We stole it from the humans. So they did the pioneering first. And I think that the evidence out there is very good.
That's understandable.
Yeah. The problem that we have, and this is a problem that I talk about a lot, is you get doctors who are out there pioneering and doing the work, like Dr. Schallenberger, and the standard of studies is to use a double-blind study. So one patient gets the things that help them for cancer and the other patient doesn't. And there's not a lot of doctors like us who want to participate in that study. So all we do as functional medicine vet or doctor is present the data of what we've been able to do. And because we're not willing to do those double-blind studies, then we have lots of people who think this is quackery, you know, this doesn't work, they won't undergo studies. So that's what we face.
Where is the best place for a human to go?
In
if they
Florida,
have it? Yeah.
in Florida, all the modalities are being offered at only one place, and that is LifeWorks Wellness Center in Tampa.
Yeah.
Clearwater, it's in Clearwater. Yeah, so, but you can do a lot on your own. So you can go to Frank Schallenberger's website, you can read lots of books, because no insurance covers these modalities, unfortunately. And so you go over there and you'll spend $10,000, $15,000 doing this stuff. And so that's another problem that we have, is that, you know, these things aren't covered by insurance, and now only the rich people or people who can afford it are able to do this, which is really unfortunate, because you can imagine ozone, homeopathy, this costs next to nothing. If we would just spend our time and effort on keeping people healthy, it would be a different healthcare system.
Sometimes when a human or an animal becomes ill with one of these problems,
Yes,
time is of the essence.
time is of the essence.
And when that happens, you don't have a whole lot of time to do any research.
Right. You're right.
Having had cancer twice,
Yes.
2 different cancers,
Yes.
I've experienced some of the problems with it.
Yes.
I've never had chemo, thank God.
Thank goodness.
In one case, I needed
Radiation.
radiation.
Yeah.
And of course, radiation is not fun.
It's not. There's side effects. There's actually proton therapy that University of Florida has.
I don't know.
developed-
Do you remember what it was?
Was it proton therapy?
No, proton therapy is relatively new. It's very powerful and it has no side effects.
It's really too bad that the medical industry doesn't make more of this available to us,
It is very sad.
because this pain and suffering of cancer
Yes.
is no fun.
You're exactly right.
And I had 2 serious problems. Thank God I lived through it without too much trouble. I mean, you know, not unscathed at all.
Yep.
Uh,
No, never unscathed, never.
and it doesn't seem that they want to change. Is it the money-making factor, do you think?
So this is, again, in my very humble opinion, but the pharmaceutical company runs this country. They have all the money. Yeah, they have all the money. And just a little, you know, as we get into the CBD oil and realizing the benefits and get into the fight of it, then on the heels of that, quickly the pharmaceutical company came up with its own CBD product that was synthetic, and it only killed 1 in 10,000 children. So therefore the FDA would approve that, because that's something that they can sell, as opposed to it.
$35,000
Yeah.
a year.
And it costs $35,000 a year. So we're for seizure disorder, right? That's it. So we're up against. I'm a very optimistic person. I am so cup is half full. But the healthcare system, I feel no optimism whatsoever. I feel like if you don't have an advocate or you're not your own advocate, then you're in trouble. And if you listen just to what the doctors say and you don't do your own homework, then you're in trouble. And you have to be your own advocate now in this world. It's sad. I'm sorry. That's
Are there
depressing
any
and on a sad note.
individuals, rather than any of the big complexes, that can perform these?
So they're here and there, like, you know, Dr. Gaffney, who does acupuncture and herbal therapy, she just ran a neurogenics test on my kid who suffers from anxiety to find out what her serotonin and dopamine level are so that we can naturally correct it. So there's little places here and there, and this up here above the radio is soon to be our where can you get the same treatment that we give your pets. So that's going to be our human corner. So we're going to try to gather the brochures that I like, the people that I've researched and put up there. for people. I mean, minimally, you know, acupuncture to just move the energy is just really has an amazing effect. But vitamin D levels are just critical. And there's just not a lot of people that even talk. I mean, has there anybody in here that their doctor has told you to run a vitamin D level? You.
I think I have.
Every
I
6
think I have
months.
it also.
So that's an indication for me. Had I asked you that 10 years ago when I started doing all this stuff, nobody would raise a hand. But now clients are starting to trickle in and tell me that they're on vitamin D. And so there's some things that are trickling in. People are starting to see. And it may have been because this article was published and it said, hey, it's just not for calcium, you know, it's also for other things as well. So there's always that hope, little things can trickle in. But I mean, you know, as far as diets and juicing and you know, whether you want to become vegan or, you know, Dr. Nicholas Gonzalez, who's huge into food, very much believed no one diet, but he would take your personality and your needs. And he would say, hey, you're a carnivore, like your body needs to eat meat. You're a vegan, like you don't need any of that animal protein, you need plant protein. And so there was a genius in what he did too, because he would really individualize the diet program. But there's just countless stories, you know, as I went through the years of staying up all night researching cancer, there are countless stories of people taking their own health in their hands and making huge differences and changing their lives with small things. So it's just you know, I wish I had a more positive answer.
Our environment is so contaminated that no matter what you do, you're exposed to something.
So that's a really good point in that he said our environment is so contaminated it's almost like helpless. But it's not really, because our environment is definitely contaminated, but there's small things that we can do, like our reverse osmosis on the house. We can not drink out of plastic. There's little things that you can do that add up, but most importantly, if your body's functioning like it should and your liver is able to detox, or you're using Chlorella, which is wonderful. It binds heavy metals and can detox your body. A lot of us have heavy metals in our body. You can do those things and you can try and detox yourself. So there are ways that you can detox from the environment. So that's not completely hopeless. If you're detoxing and you're maintaining good health, then your body is going to be able to excrete the toxins much more readily than a person who's not in good health.
With all the packaging of foods and plastics,
yes, it definitely.
you would think that somebody or some group of doctors would attack that and do something about it.
So I just had a blood test that was like all the toxins in the environment, like when I'm most high in plastic. And I try to do the best I can to stay away from plastic, but it's almost impossible.
Yeah.
So until we have legislation that gives us what we need and what we want, which is to outlaw and ban plastic.
Go back to glass bottles and glass jars.
Yeah, we got to go back to the way that life was. Then we just got to do what we can to fight the toxins. Yeah, that's a good point.
Now that sauna wave,
Yes.
is that always followed up with surgery, or can you just do the sauna wave?
Sometimes I just do the sauna wave,
Oh,
especially with Benny.
yeah, that's what I was wondering.
Yep.
I'm bringing him in Tuesday for a sauna wave. I guess he needs a year and then on
He does.
his leg, but I didn't know if. Well,
So
it probably eventually will turn out to be surgery again, but I'm
It's
hoping
kinda-
it'll shrink it down a little.
It's kind of new to me too. So I don't know. Each case is a learning tool for me. And I don't mean that like, oh, I'm experimenting on your animal. It's just that sometimes it's not as effective as I want it to be. So we just,
And that mushroom that I was seeing, because you said that wasn't his cancer a blood cancer? Or
it
something?
is.
Would
Yeah.
that help for him?
Yeah.
Or?
Part of salmon.
So
So
how would I go about getting some of that, or?
yeah, we can do that. We can mix it in his herbals too. He's just on a lot of stuff.
Yeah, I haven't been giving him that other herbal stuff, the brown stuff, because it was making him sick.
So we need to readjust it. So we
Yeah.
will. Yeah. So we'll try some different things and see.
Okay.
And sometimes with cats, we can just do it.
Yeah, and then with his age too,
Yeah.
so I'm trying to.
Yep.
Because
Yeah.
he's a
He's a special
he's something.
Did the mushrooms work on Jasper?
Yeah, mushrooms are great. So stay tuned. I'm trying to create a supplement that is really beneficial for the gut. We're gonna have a probiotics, prebiotics, digestive enzymes, mushrooms, green algae, colostrum, and NAC in it. And so I'm hoping that I'll be done with that soon. In the meantime, there are a lot of products that we have. My problem is that there's so many things I want to put your animal on that I literally would send you home with a bucket of supplements, and you're all going to say, nope, like that's not even going to work. So I do have to pick and choose. Yeah, like all of us here at FloridaWild pick and choose what we think at that time is the most important thing for your animal, that they eat it, that they do well, that their GI tract is healthy on it. But if I can get this supplement that incorporates all the things that I want done, if I can get that formulated, then that's just one gut health supplement. That would be great. So I've been working on this for a long time, but hopefully I'm rounding the corner on it. It would be great. Everybody needs to be on it. Everybody needs gut health.
Does that vitamin D liquid need to be refrigerated?
I don't know.
I haven't
That's a good
refrigerated it, so I didn't know.
Does vitamin D have to be refrigerated if you open it? I don't think so either.
Okay,
I mean,
Good.
it depends on the time, but the one
Yeah.
that I have doesn't.
okay.
Yeah.
Good.
Maybe just read it, just make sure I'm not
But
telling
on the
crazy.
bottle, it was covered up with a
Yeah,
label,
mine
so
too.
I couldn't see.
Yeah, mine too.
I couldn't tell.
That's
The
so great.
problem
Make
with
sure.
some of the.
We're sending it down. We're sending Hannah down to investigate for us.
Controlled room temperature, I think.
Okay, I think so too. I can't remember.
Yeah.
Usually, every once in a while I make a mistake, but usually I'll save the labels where it says.
Sometimes it
stored.
does say on
Yeah,
the labels
yeah.
to refrigerate.
Yes, so
not
I try to be
refrigerate or
good
whatever.
about that. We'll see.
And that CBD oil stuff, will that hurt anything other in their organs, like their liver? Because I
So-
give it to Caesar all the time.
The thing that CBD oil does, and the reason why I say it's not good for everything, is that I flip-flop from Chinese medicine. So Chinese medicine is a very damp oil. So patients that are prone to diarrhea or prone to dampness of the skin, I tend to stay away from oils. And by darn it, you give it and they don't do well with it. So those are the patients that typically don't do well with CBD oil. All the supplements have energetics. So
Well, he's doing good on it. It's just that his liver values went up a tad. So I didn't know if that had anything to do with it or.
I don't think so. My thought process is that we stop the intravenous amino acids.
Okay. It wasn't bad. It
It
was just
wasn't
a
bad.
tiny bit.
Yeah. But I do wonder about stopping the intravenous amino acids.
Okay.
Can humans consume the CBD oil that you give to
No,
It's for animals.
no.
different?
But you can get it out there, can't you?
Bluebird has a really good one. Also, Dr. Gaffney sells a company. She's a complementary medicine on New York Avenue.
Yeah.
She's got a
good.
company that she likes. She's wonderful. Yeah.
She is.
So she's got a CBD product.
Acupuncture and-
But I may have given my daughter CBD oil when she was having a
That's the stuff made of
for
hemp,
the
right?
pets.
Yeah.
I sent the marketing director down to the pharmacy to look.
Oh,
So I
you know who
tried-
it is.
I don't know who it is.
Okay. Where's Dr. Barbara?
You just want to get a snack, you
Okay.
know.
We'll get that answer for you. Anybody else? Come on, check.
I could probably answer that.
What?
Vitamin D is an oil,
Yeah.
so you want to treat it like you treat your olive oil or something. Like
That's refrigeration.
No, you don't.
No.
I don't
You refrigerate omega fatty acids.
I do my grapeseed oil.
Oh yeah, you refrigerate omega fatty acids.
Like an olive oil?
No, not olive oil.
Yeah.
But you
Maybe
do
a grape
refrigerate
oil.
omega fatty acids,
What?
and you refrigerate the hemp oil that we have after you.
Yeah, I put that in there.
We don't refrigerate ours.
Maybe it's just refrigerate to decrease the increase the palatability.
Oil
That
goes
could be it.
rancid. It doesn't go bad for bacteria.
Right.
So the rancidity would be caused by exposure to oxygen, yeah?
So maybe it's just to increase palatability, that's why you put the fish oils in the. Does anybody know that trick? If you take fish oils, do you burp fish oil after? Put it in your freezer. Yeah, put it in your freezer and you won't burp fish oil. It's
I
really
didn't
nice.
know that. That's interesting.
Yeah, that's a really nice trick.
Same
So,
garlic oil.
let's see. Woo! That's a way not to have any friends. Thank you guys, always.
And how do we
Such a
get copies
pleasure.
of this?
See me right
Hannah
now.
Banana.
I'll do it to. I'll send it to you right now.
I can find the last one.
Then see me right